Thank you, Dean.
Thank you. Thank you, Chair. I'm going to wrap my questions all into one because I know that there's many of my colleagues who would like to come in. So forgive the length of the question, but please do hopefully answer all the parts. So my questions relate to the role of monitoring compliance. We as a committee are incredibly keen to understand whether care homes are actually implementing government guidance on visiting care homes. We've had many witnesses, many reports that we've read, and we wrote to the CQC expecting that you would be able to tell us. But you said, as the CQC, that you didn't collect this information. So first of all, why don't you monitor adherence with visiting guidelines? Or if you do, can you please clarify that? Last week, the Chief Executive of Care England told us that the fact that you aren't able to supply this information suggests a more fundamental problem with data collection within the CQC. So I'd like to know whether you agree with that. And then thirdly, I'd like to get a really clear idea from you whether you see the visiting guidance as advice or as guidance, which must be followed. So if you don't mind covering those 3 points, if I may start with you, Peter, and then come to you, Kate. Thank you.
No, thank you, Mr. Russell. And I apologise if my letter to the chair wasn't sufficiently clear and caused some misunderstanding. So we absolutely collect data all the time. And our data starts with our understanding of a home when it first registers with us, and then that data is constantly updated by our information that we ourselves collect and information that comes in from members of the public and so on. So it's a very live set of data, which is why we weren't able to say at a particular moment of time we can tell you, precisely how many homes have got what visiting rights. It constantly changes. So that was the point.
You could have, forgive me, but you could have then said this is a snapshot. Well, but you couldn't. There wasn't anything unclear about your letter. You said you couldn't give us the information because we're trying to get it to sense. We hear, as Dean said, that loads of people can't get the visits that the guidance says they should have. And we wanted to get a sense from you as the regulator and the monitor and the inspector, at any one time, what percentage of care homes, in your view, are actually complying with the guidance, and you couldn't give us that information.
Well, as I said, I'm sorry if my letter wasn't clear, but I can tell you now, at this moment, we are not aware of any home that is not providing appropriate visiting rights. And where we have been, as I said a minute ago, where we have been contacted by relatives who said we haven't got the visiting rights, we have pursued that and we have satisfied ourselves that either the visiting rights were always there and there was a communication failure, or there needed to be a change so that the home has changed and the visiting rights are now there. So I can absolutely say that as of today, as of this moment, we are not aware of any home that is not making appropriate visiting rights in accordance with government guidance. And to your point, Mr. Russell, we regard the government advice as something we are expecting homes to follow. And Kate was very clear right at the start and has been clear in communications to care home providers over the past 12 months that we expect government guidance to be adhered to. So
sorry to interrupt, but can I just ask a very specific question? On the data collection, you mentioned that you are tracking how many homes and you can assure us at the moment that no homes are stopping visitations and so on. But have you got a data set that says over the past 12 months how many visits have happened across each home? Because if not, how can you be assured that the volume of visits has been accurate compared to the number that should have been able to visit?
So we certainly don't have that particular data.
How then, in that case, have you been able to monitor over the past 12 months whether that's been implemented? The bit that I don't quite understand, forgive me, but I don't quite understand how you can be assured of any figures if you don't have the figures, and be assured that things have been followed if you don't know what's been followed or not.
well over 20,000 care homes, 25,000 adult social services that we regulate. And what we're doing is in constant monitoring of those providers, and we're getting information from the providers and from the relatives and from what our inspectors themselves are seeing. We've carried out inspections during this process, during this period, as well as monitoring calls.
Sorry to interrupt again, but
yes.
Can I ask, is that qualitative data or quantitative data? I.e., can you say as a snapshot at any point in time, X number, 1,000 people have had visits at a certain care home, or is it more a qualitative thing that they've been able to have visits, and it would therefore be up to the family to then say that that's not been the case?
Yeah, thank you. I think you've put that very well. Thank you. We are very much interested in qualitative data that we can verify. So this is not just asking for data from the homes, which may or may not give you a complete picture. This is very much us taking a qualitative view of whether what the home is providing at a point in time, at any point in time, is appropriate to the circumstances of that home at that moment, because this is constantly changing, as we know.
I understand that. I really do understand that. I just don't understand. The bit I don't understand is surely there will be a register of visitations in each home that would have a numerical value to it, whether it's 10 visits or 1,000 visits. And given the number of homes that you oversee, surely there must be a way for you to be able to track how many visitations have happened, and that should be recorded somewhere, so that then when you're reviewing that, you can see that there's been a massive drop-off in certain care homes, or there's been a trend. Because surely if it's only based on qualitative data, you're only then getting a snapshot at the point that you're doing the review, not a regular flow of data to see where the patterns of flow are happening, if that makes sense.
Yeah. I mean, it makes sense, but I don't. What I was trying to say in my letter to the chair, and what I obviously haven't expressed very well, is we have not collected that data, formed a register, added it up on a daily basis across all those homes that we regulate. What we're much more interested in is being sure that there is appropriate visitation rights, and appropriate is obviously the key word, at a point in time. Now, when we do an inspection, then we would obviously look at wider data. If we are following up and we are concerned that there may not have been appropriate visiting because a resident's family may have told us that, then we can absolutely seek the data that you've suggested.
Yeah, thank you. I should go to Kate, if I may. I'm conscious of time. Kate, the same questions to you, but if you could shed any light on whether there's whether there is a process to gather that data across all those care homes, because it just feels to me that the idea of live data for me means that you've got a regular track of analytics, whereas it sounds to me like you've got more of a snapshot of instances where you've inquired or where a family has raised a concern. I'd just be interested to know, whether that's, if next week there was an inquiry that said how many care home visits took place over the past year, whether that would actually be available and how long it would take to do, and with relation to my other questions. Thank you. Sorry, over to you, Kate.
Thank you. So we don't have that as we speak. Our focus is about, are people getting kind of high quality person-centered care? And we have a number of ways of establishing that. So we put out our messaging and have kept putting out messaging over the last year to say we expect providers to follow government guidelines, listen to local advice, but we want to see person-centered care plans to make visiting happen. So we've been really clear in our expectation of providers. We meet weekly with local authorities and clinical commissioning groups to find out what they're hearing out on the ground when it comes to visiting. We also have met regularly with corporate providers, so those large care home providers, to establish what are they doing at a corporate level to make visiting happen. So they might share with us their visiting policies. We would also ask them but what evidence they are doing to assure themselves that maybe across their 100 care homes, they are all taking a person-centred approach to make visiting happen. And then in addition to that, we send out our inspectors to kind of corroborate that information. So it's not a day by day, on Monday, how many care homes are making visiting happen, because it is so complex. You know, if there's an outbreak in a home that happens on the Monday, they would take certain action. We do have examples where, so just in the last couple of weeks, where there have been concerns about blanket approaches to visiting, we have intervened and met with the registered manager or the regional manager. And as a result of that, families have been able to see loved ones, and that organisation has changed their approach. So I've got letters in front of me.
Sorry to interrupt you again. The bit I just really don't understand, and I appreciate this is, you know, the horse has bolted, I suppose, in some ways in this aspect, but I could look at a dashboard now and get a sense of how many vaccinations have happened over the past week, how many hospital beds are full, lots and lots of different data around hospitals, for example, which is all stored and has to be verified and all the rest. I just would have assumed that the CQC would have had a similar thing for care homes, because it can't be that hard to set up a registration system to just literally track numbers of visitations. And then surely you would then have been able to see patterns of behaviour, where if there'd been a lot of visitations, perhaps that might have caused an outbreak, or perhaps not, whatever it might be. But it just feels like you're having to work a little bit blind, or am I totally misunderstanding the data you've got?
Well, sorry, I mean, if Kate, you may want to come in, but I mean, we're certainly not working blind. Quite the opposite. I think we are working constantly with the sector to understand what they are doing on a day-to-day basis. But you're right, Mr. Russell. We have not thought it a good use of our resource to compile the sort of register that you're suggesting. I mean, I understand where you're coming from, obviously, but it's just not the approach that we have adopted. So we can't supply that data in that format. But I am very confident, as I said earlier, that we have good visibility of what care homes are doing on a day-to-day basis, and if the visitation rights are not appropriate, we are taking the action to get that changed. So I think we are doing what you as a committee would want us to do, in the sense of making sure that people can visit their loved ones safely as appropriate. We're just not perhaps doing it in the way that you had envisaged.
Thank you, Dean.
Thank you.
Thank you, Chair, and thank you, Minister, for joining us today. The government issued new guidance on care homes visiting effective of the 8th of March 2021, and again earlier this month, effective of the 12th of April. Could you share what evidence do you have that care homes are facilitating more visits as a consequence of the guidance, please? And if I may, just an additional question to that is, have you found any discernible difference between the way the guidance has been implemented in the more expensive care homes versus to the more publicly funded provision?
Thank you for the questions. And I also heard your question to the CQC about monitoring. So I know, and as somebody who is keen on data myself, I understand where this is coming from. So since we have, and actually even before that, the latest guidance that you refer to, we had introduced ways of understanding the level of visiting going on. I guess there's two main ways that we have of getting a sense of the situation. One is through the work that CQC does, and I know you've heard from CQC, and we spoke with CQC some time ago about making sure that they specifically looked at visiting as part of their inspections, and had a question which would ask about whether care homes are following the government guidance. So there's one route, which is CQC, and then the other is the data collection system that we have established during the pandemic, called the capacity tracker, which is filled in by social care providers on a, it is up to them to do it, and we strongly encourage it, should I say, and a significant proportion of care providers do fill it in frequently, and that gives us a sense of the extent that visiting is going on. And so, for instance, I've been looking at that since the latest guidance has been published, and have been seeing a steady increase in the number of care homes who say that they are supporting visiting, including supporting indoor visiting. So that is one form of evidence that we have.
Sorry to interrupt. Following on from my questions earlier, though, would you agree that it would make sense to have a very simple measure of number of visitations for each care home, so that there's a macro view of trends, just generally, whether we've got pandemic or not, so that there's an ability to monitor and track that activity?
Well, I know that I would also like that, but I am aware that of needing to be conscious of the sector that we are talking about here, where we have around 15,000 care homes, some of whom may have 100 or so residents and administrative staff and IT, and be well set up to be able to report a substantial amount of data. Other care homes will only have a handful. It might be a converted house with 5 or 6 people living in them, and some won't even necessarily have a computer. And there is a separate piece of work that the department is doing to improve the IT infrastructure and skills of the social care sector. And another thing that we have heard during the pandemic is quite a lot of resistance on the administrative and reporting requirements that the department has made of care homes. So, for instance, we are asking care homes that when their staff are tested, they should upload the test information, and also now when they're testing visitors, also upload the results of that visiting testing. That's very time consuming. We're providing funding to support with the extra cost of doing that. But I give that context by way of asking for what seems like a straightforward piece of data can actually involve a substantial amount of work for care providers who are already really, really stretched, doing things with takes extra time when they are working with PPE and in fact supporting visiting, but in the very careful way that visiting is happening. So I'm trying to be proportionate in what we ask of care homes, but this tool, the capacity tracker, does give us a certain amount of evidence. And what we are then doing is we have created a regional assurance team. So that's a small team based as part of the department of individuals who have experience the social care sector. And what they're doing is following up, and where it looks like visiting isn't happening as you would expect, working with local authorities to say, well, no, what is going on? Why isn't visiting happening? And so, for instance, so far what I'm hearing back is they are hearing of only small handfuls of care homes that aren't supporting visiting. And the most usual reason for that at the moment is because there's a current outbreak, and therefore visiting is not advised except for the end of life exception.
No, thank you. And may I just come back to the question about whether there's a discernible difference between the more expensive versus the publicly funded provision, if you have that information?
Yes, my apologies for not picking that up. I haven't seen anything to suggest that. I think it's clear that there are some slightly different approaches. Some care providers have invested more in visiting pods and setups like that, and have been keener to continue using those until their residents have had their second dose of the vaccination. But I haven't seen a particular, haven't seen any evidence that shows me there is a particular split in along the divide that you suggest.
Thank you, Minister. Back to you, Chair.